Good morning. Today we are discussing fentanyl, a potent synthetic opioid analgesic that is widely used in clinical practice for the management of severe pain and as an adjunct to anesthesia. It's crucial for us as frontline clinicians to have a comprehensive understanding of fentanyl's pharmacology, indications, contraindications, and potential risks. Fentanyl is an opioid agonist, meaning it binds to opioid receptors in the brain and spinal cord, primarily the mu-opioid receptor. This binding leads to a cascade of events that ultimately reduce the perception of pain. However, it's essential to remember that fentanyl is significantly more potent than morphine, estimated to be 50 to 100 times stronger. This increased potency contributes to its efficacy in managing severe pain, but also necessitates careful dosing and monitoring to prevent adverse events. Fentanyl's high lipophilicity allows it to rapidly cross the blood-brain barrier, resulting in a quick onset of action. This characteristic makes it valuable in situations where rapid pain relief is critical. The primary indications for fentanyl include managing severe pain, especially post-operative pain, breakthrough cancer pain, and chronic pain in patients who are already opioid-tolerant. It is frequently used as an anesthesia adjunct during surgical procedures, often in conjunction with other anesthetic agents. Furthermore, fentanyl may be employed for procedural sedation, such as during colonoscopies or other diagnostic procedures. Transdermal fentanyl patches are specifically reserved for managing chronic pain in opioid-tolerant patients, as they provide a sustained release of the drug over several days. Several contraindications exist for fentanyl use. Patients with a known hypersensitivity to fentanyl or any of its formulation components should not receive the drug. Significant respiratory depression is a major contraindication, as fentanyl can further suppress respiratory drive. Similarly, patients with acute or severe bronchial asthma should avoid fentanyl, especially in unmonitored settings without immediate access to resuscitative equipment. Oral and transmucosal formulations are contraindicated in patients with paralytic ileus. Transdermal patches are not appropriate for opioid-naive patients due to the risk of overdose. Concurrent use with monoamine oxidase inhibitors or within 14 days of discontinuing an MAOI is also contraindicated due to the potential for severe and unpredictable adverse reactions. Fentanyl is available in several dosage forms, including injectable solutions for intravenous or intramuscular administration, transdermal patches for sustained release, transmucosal lozenges, buccal tablets, and sublingual sprays for breakthrough pain. The availability in multiple forms helps in tailoring the medications and routes of delivery to the distinct needs, severity of symptoms, and routes applicable to the patients. Dosage must be individualized based on the patient's age, weight, opioid tolerance, clinical status, and specific indication. Intravenous or intramuscular dosing typically starts with low doses, such as 25 to 100 micrograms, and is carefully titrated to achieve the desired effect. Transdermal fentanyl dosing is based on the patient's prior opioid requirements, converted to an equivalent fentanyl patch strength. Numerous cautions must be observed when using fentanyl. Respiratory depression is a primary concern. Therefore, continuous monitoring of respiratory rate, oxygen saturation, and level of consciousness is essential, especially during initiation and dose titration. Hypotension can occur, necessitating monitoring of blood pressure. High doses of fentanyl can cause muscle rigidity, potentially impeding ventilation. The abuse potential of fentanyl is significant, highlighting the need for carefully assessing risk factors before prescribing. Prolonged use can lead to tolerance and physical dependence, with withdrawal symptoms occurring upon abrupt discontinuation. clinicians must be vigilant about drug interactions, particularly with other CNS depressants such as benzodiazepines, alcohol, and certain antidepressants. Serotonin syndrome is a potential risk when fentanyl is used concurrently with serotonergic medications. Elderly patients are more sensitive to fentanyl's effects, warranting lower doses. Fentanyl can cause neonatal opioid withdrawal syndrome if used during pregnancy. Dosage adjustments are often necessary for patients with impaired hepatic or renal function. Accidental exposure to transdermal patches poses a significant risk, especially to children and pets. Several controversies surround the use of fentanyl. The rise in illicitly manufactured fentanyl and its analogs has fueled the opioid crisis, leading to a surge in overdose deaths. Prescribing practices have come under scrutiny, with concerns about overprescription contributing to addiction and diversion. The long-term use of fentanyl for chronic non-cancer pain remains a subject of debate due to the risks of tolerance, dependence, and adverse effects. Public perception of fentanyl has become increasingly negative due to its association with overdose deaths and the overall opioid crisis. In summary, fentanyl is a potent and valuable analgesic agent when used appropriately. However, its potential for adverse effects and abuse necessitates careful patient selection, individualized dosing, thorough monitoring, and a comprehensive understanding of its pharmacology and interactions. Thank you for your attention. Please let me know if you have any questions.